Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Early exposure guidelines cut down peanut allergy cases. Break-in number 148, encouraging parents to introduce peanuts to their infants early has led to a significant drop in new allergy diagnoses, according to researchers at the Children's Hospital of Philadelphia. Break their study and number 148, published in the November issue of the journal Pediatrics, and number 148, is the first large-scale analysis to show the real-world impact of the new feeding recommendations and a successful public health intervention. Break anaphylactic food allergies and number 148, in which the immune system overreacts to foods like milk, egg or peanut, and number 148, affect about 4% of children and can cause immediate, severe reactions such as hives, swelling and difficulty breathing. Break peanut is among the most common causes of these reactions, which are also known as immunoglobulin E, IgA, mediated. Break the shift in public health policy was driven by the 2015 Learning Early About Peanut Allergy, LEAP, trial, which found that regularly feeding peanut products to high-risk infants, those with severe eczema or egg allergy, reduced their risk of developing a peanut allergy by 81%. Break following the LEAP trial, major pediatric and allergy organizations released guidelines in 2015 and 2017 focused on high-risk children. Break these were broadened in 2021 to support having caregivers introduce major food allergens like peanut and egg at 4 to 6 months of age for all children without a history of a prior reaction. Break and number 156, everyone has been wondering whether these landmark public health interventions have had an impact on reducing rates of IgA-mediated food allergies in the United States, and number 157, said Dr. Stanislav Gabrysevsky, the study's first author and an attending physician at Children's Hospital of Philadelphia, CHOP. And number 156, we now have data that suggest that the effect of this landmark public health intervention is occurring. And number 157. Break analyzing the decline. Break the CHOP team analyzed electronic health record data for more than 124,000 children. They compared food allergy diagnosis rates before the guidelines, after the initial guidelines, and after broader 2021 guidelines were adopted. Break from before the 2015 guidelines to after the 2021 addendum, the results showed a significant reduction in new diagnoses of break peanut aller less than /speak G, down from 0.79% to 0.45% of children in the study. Break any IgA-mediated food allergy, down from 1.46% to 0.93% of children in the study. Break for roughly every 200 infants who received early exposure to food allergens, the authors estimated that one child was prevented from developing a food allergy. Break furthermore, egg allergy surpassed peanut allergy as the most commonly diagnosed food allergy after the guidelines were put in place. Break while the early exposure approach doesn't completely eliminate food allergies, experts consider the observed reduction a major public health victory. Break and number 156, our findings have relevance from those of us who treat patients to those caring for infants, and more awareness, education and advocacy could further increase the positive results we observed in this study, and number 157, said senior study author Dr. David Hill, an attending physician with the Division of Allergy and Immunology at CHOP. Break. Dr. Hill noted that and number 156, future studies could potentially explore specific feeding practices that help us better understand the timing, frequency and dose of foods that optimize protection against food allergies. And number 157. Break. In an accompanying editorial, writers welcomed the findings and called for continued follow-up on them. Break. If confirmed, these findings would represent a meaningful public health advance. And number 148, A and IUML semicolon and not semicolon. And number 131, ring that clinical research, when coupled with clear guidelines and committed dissemination, can indeed shift the trajectory of childhood food allergy, Wrote a team led by Dr. Ruchi Gupta of Northwestern University Feinberg School of Medicine in Chicago. Break sources: Children's Hospital of Philadelphia, news release, October 28, 2025. Pediatrics, November 2025. Break disclaimer: statistical data in medical articles provide general trends and do not pertain to individuals. Individual factors can vary greatly. Always seek personalized medical advice for individual healthcare decisions. Break and copy, 2025 Health Day. All rights reserved. Break ad as a preferred source on Google. More news resources: FDA MedWatch, Drug Alerts, Daily Med News, news for health professionals, new drug approvals, new drug applications, drug shortages, clinical trial results, generic drug approvals. Subscribe to our newsletter. Break. Whatever your topic of interest, subscribe to our newsletters to get the best of drugs.com in your inbox. rxcardclub.com. Get a free prescription drug card and SAR less than /speak. Speak V up to 80% on prescription drugs. Less than /speak.